This is our charming and energetic 4-year-old daughter Rasmi. She always has a huge smile on her face, especially when she is playing with her little sister Maxima. Rasmi was born with a profound sensorineural hearing loss in both ears. This type of hearing loss makes it harder to hear certain sounds, including speech. Rasmi was 2 years old when she had a surgery and received a cochlear implant that helps her to hear sounds better. A cochlear implant works by turning sounds into electrical signals and directly stimulating the hearing knob to the brain instead of sending louder sounds into the ear. With normal hearing, talking sounds like this.
One cold, rainy day, when my father was a little boy, he met an old alley cat on his street. The cat was very drippy and uncomfortable, so my father said, "Wouldn't you like to come home with me?"
For Rasmi, the same talking sounds like this.
One cold, rainy day, when my father was a little boy, he met an old alley cat on his street. The cat was very drippy and uncomfortable, so my father said, "Wouldn't you like to come home with me?"
As you can tell, it is much harder for Rasmi to understand speech clearly. This is especially true in noisy places like a busy restaurant or a crowded classroom. This is only a simulation of the cochlear implant's performance. Many cochlear implant users report that with consistent use, fine-tuning, and ongoing therapy, their perception of sound becomes much more natural over time. The more that she hears sound and language from us, the better she will learn to understand. Rasmi's cochlear implant has several different parts. There is a microphone placed in front of Rasmi's ear that captures the sound from the environment, and these sounds are selectively arranged by a processor to improve speech understanding in noise. Then the circular transmitter receives these sound signals and converts them into electrical impulses. Lastly, a device that was surgically implanted into Rasmi's inner ear gives her access to sounds by sending sound information into the brain. Rasmi is doing great with her implant. It gives her access to the sounds and she can do lots of things that she couldn't before, like hear from a greater distance, hear in the car, and hear things from the other room. However, it is not the same as normal hearing because the sound information that Rasmi's brain receives is different from the sound information that other people get from their ears. Even though Rasmi hears well with her cochlear implant, she is at a period where she is just starting to understand words, develop her speech, and expand her vocabulary. It is common for children with hearing loss to experience speech and language delays, especially if it was diagnosed at a later age. It is important for newborns and children up to 3 years of age to be exposed to different sounds because it helps with the child's development of speech and language skills. Since Rasmi was implanted when she was 2, it will take her a little more practice and effort to be able to talk well and clearly. It would be beneficial for Rasmi if you use visual cues and American Sign Language when talking to her. In addition, any caretakers or teachers should be able to help Rasmi with her cochlear implant. Here is what you can do if you notice that Rasmi is not responding when you are talking to her. Number 1. Make sure that the headpiece is placed correctly on Rasmi's head. If the headpiece is misplaced, place it on Rasmi's head and you should feel a magnetic attraction over the internal implant. Number 2. Make sure that the battery is fully charged. If you see the LED light in orange and it is blinking 3 or 4 times, then it is the time to replace its battery. Number 3. Know what each LED color means as it can tell what the problem may be. The orange light is for battery status. The green is for the microphone status and program position. And the red light is for the CI status. Number 4. Look for any visible damages on Rosmi's device such as the headpiece cable, microphones, processor and battery. If there are damages, it is important to contact Rosmi's audiologist immediately. Rosmi is bright, capable and ready to learn. Here are some things you can do to facilitate effective communication. Number 1. Talk to Rosmi and keep her engaged. Rosmi is at the age where she is actively learning language and expanding her vocabulary. Narrating your daily activities or reading her favorite book is a great way to provide her with lots of opportunities to learn language. Additionally, keeping Rosmi's attention by singing or playing simple toddler games is a great way to help her build communication skills. These are important building blocks for learning to communicate thoughts and needs. Filling Rosmi's life with words will help her get ready to succeed in school. Number 2. Provide a good listening environment by reducing any background noises. Rosmi will have the easiest time listening when she can see your face and there is no background noise from things like TV, radios and dishwashers. When you can help by reducing noise in the room or finding a quieter part of our room to talk to Rosmi. You can also help by moving closer to Rosmi when you are talking to her. Number 3. Use visual cues and facial expressions. Speaking in a clear voice and using visual cues will help Rosmi to understand you better. This can be as simple as pointing to things that you are talking about. Also, learning American Sign Language is very helpful since toddlers with hearing loss often miss certain sounds and words when listening to speech. Adding visual communication is helpful because then she can use both what she sees and what she hears to understand you best. Number 4. Repeat and rephrase. Even when they are paying attention, children with hearing loss are more likely to miss out on sounds and words in a conversation. When Rosmi didn't understand your message, you can help by repeating what you just said or rephrasing it so that Rosmi can understand. For example, instead of saying put toys in the bag, you can rephrase it to bye bye toys and use visual cues to help Rosmi understand what you are trying to say. Please don't say never mind or don't worry about it. These responses can be very frustrating for people with hearing loss because it makes them feel left out. Doing these things will really help Rosmi to have an easier time understanding you and will also help her speech and language development to be successful in school. Thanks for listening.